Today we're going to be starting on your phase 2, 3 and 4 exercises post hip replacement. These exercises should be started from the 4-week mark unless contraindicated. That could mean if you've had a revision hip replacement or if you have any fractures in and around the hip, your physio will be able to guide you as to when you're allowed to start each of the phases. From this 4-week mark, in theory, you have no more rules. So you are allowed to bend past your 90 degrees, you are allowed to cross your legs, twist, and you may also start walking without your crutch indoors. The exercises, phase 2, 3 and 4, are designed to get your mobility back, to start strengthening and work on your walk. So you need to ensure that firstly you listen to your body. Just because there are no rules doesn't mean that everything is functioning and working normally. You need to go slowly, you need to build up. When you're doing these exercises, you need to be sure that you do them as well as possible, but not forcing yourself or pushing so that your flare-up will be sore. So listening to your body, starting off with fewer repetitions, and ensuring you're trying to do the exercises as best as possible will give you the best results. We've divided the exercises, phase 2 being stretching exercises, phase 3 strengthening, and then phase 4 looking at balance, proprioception and walking. Phase 2 exercises. These are the stretches. It's very important for us to start stretching out your new hip replacement. We need to stretch out scar tissue, make sure we get mobility back into the joint. A lot of you would have come into this operation with a very limited range of movement, and it's now the time that we need to start slowly but surely encouraging that range. When you're doing your stretches, make sure you take your stretch just to that point of discomfort. You want to be feeling the stretch, but you don't want to go past the stretch into pain. That'll only lead you to flaring up your joint and making yourself very uncomfortable and sore. So listen to your body again. Importantly, hold your stretches for a good 40 seconds to a minute. You're only going to be doing morning and afternoon stretches, except for the third one, which we'll do more often in the day. So there are 3 stretches. Here they are. For the purposes of this video, my right leg, the tape leg, is my operated leg. When you're doing the stretches, you can do them lying on your bed. You can be a little bit propped up, you don't have to be flat. First stretch is simply going to be bending up both legs in bed and very gently letting the knees drop out, opening up that hip joint. When you do this, you'll feel pulling on the groin as well as on the outer scar area. This is normal, and just encourage and hold your stretch for about 40 seconds, not into pain, just into that light stretch. So a very simple first stretch to get going on. Our second stretch, because you are now allowed to bend, we want to make sure we get as much hip flexion as possible. So in line, you'll bend your right knee or operated leg, grab hold either on top of the knee or underneath, whichever you prefer, and very gently you're going to encourage bringing your knee up towards your chest. Make sure when you're doing this, you don't twist the body. You want to keep as straight as possible. It is very normal to feel pain and discomfort or pulling in the groin. So again, stop at that point where you're feeling your discomfort. And it also is very normal to feel like the leg wants to go out to the side a little bit as you're bringing it up. This is okay. Just stop at your level and hold for another 40 seconds. During the day, you can, however, bend down to pick things up, and that'll also encourage getting that range of movement back in the hip. For our third exercise, this is important and practical for getting to your foot, washing it, tying shoelaces, etc. You're going to take your operated leg, cross it over the good leg, slowly slide the ankle up the shin towards the knee. At that point, you bend your good leg, and very slowly, if you can, and pain allows or stretch allows, you'll push your operated leg out. This gives a very big pull on your scar area. It's very normal. Again, don't force, stop where you feel you need to. This third exercise or stretch, we want you to encourage doing more often in the day. So if you're not on your bed doing it, you can do this exercise in sitting. So you're sitting on any chair with a backrest. You will cross right leg over left slowly, and you can help draw your ankle up over your shin. And for some of you, that's as far as you feel you can go, and then it's pulling. You hold it there. If you can, you gently get it over the knee. And again, with time, slowly pushing that leg out to the side, feeling a nice stretch into the glutes or buttocks area, and holding for 40 seconds to a minute. So those are the 3 stretches that you'll be following. Go slow, don't force. Your movement will come with time. Just encourage it. Phase 3 exercises, they are all about strengthening the operated leg, making sure that we strengthen not only the leg, but more importantly, the glutes or the bum muscles. The glutes help to stabilize the pelvis, so that as you stand on the operated leg, you don't feel like everything's caving in and you're sinking and limping on that leg. There are 3 exercises with regards to strengthening. The first is bridging. You can do this lying on your bed, but if you feel your bed is a bit soft, it might be a bit better to do it on the floor. So, lying back. First part, to bring both knees up. Again, right leg's my operated leg. You're going to think about pulling your belly button in towards your spine, tightening your glutes or your bum muscles, and slowly lift the pelvis. You want to ensure that the hips are level. You don't want to be to one side or the other. Nice and straight. Clenching the bum muscles. And you're going to hold for a count of 5, 4, breathing the whole time. 3, 2, 1. Slowly down. And that is the first part to bridging. This is what you're going to start doing. You'll perform 5 repetitions, lifting, holding for a count of 5. So once more, it's push the heels down, tighten the bum muscles, hold, keep breathing. Make sure you're nice and level. 5, 4, 3, 2, 1. Slowly down. When you feel like this exercise has improved and you want to progress to the next part of it or the challenge, that is the leg lift option. So again, in line, you will lift the pelvis, nice and level, breathe, hold, and first thing is to extend the operated leg. 5, 4, 3, 2, 1. Slowly down. As you lift in your leg, you want to make sure that your pelvis stays nice and still. There's no dropping of the bum, no twisting of the pelvis. What we do to one side, we of course must do to the other. When we lift our good leg and put the weight onto the operated leg, this will be a lot more strenuous. It's normal. Just hold as long as you can. If it's not a slow count of 5, do 1 or 2, you'll slowly build up. So again, bum, lift the pelvis, keep breathing. Make sure you're nice and tight, nice and straight. We lift the good leg, putting weight on the operated. 5, 4, 3, 2, 1. Slowly down. You want to start with just doing 1 on each side, and as you feel you get a little bit stronger, you can progress to 2, to 3, to 4, eventually 5 lifts on each side. For our second strengthening exercise, you're going to lie on your good side, operated leg lifted up. First part to our second strengthening exercise is called the clam. Operated knee stays flexed, feet stay together, and you're just going to lift the leg up and down. Slowly up, pause, and down. With this, you should be able to do 5 repetitions, and as you feel stronger, building up 10, 15, etc. That's part A to lying on our side. If that is going well, you start bringing in part B, which is now instead of just lifting the knee, you're going to lift the foot and the knee. We call this the fire hydrant. Picture a dog cocking his leg on a fire hydrant. It's a much heavier lift to do because you're lifting both the knee and the foot. So just start with 1 or 2. And as you feel stronger, you can progress to doing more. Again, make sure your back with both of these exercises stays nice and still. You don't want to be rotating the pelvis to help get the lift off. So nice and still, just lifting the leg up. The third part to these exercises is the straight leg. So lying straight, the bottom leg can be slightly bent if you'd like, and you're trying to keep your leg up and down. This is a very long lever, so you might not get it for the first week or two after trying these exercises. It will eventually come as you build. Please don't strain yourself, forcing yourself to do it. Again, making sure you're nicely aligned. You don't want to be rotating and lifting. Nice straight line, lift up and down. Lifting up and down. If we look at our final strengthening exercise, we're going to keep you rolling and put you onto your stomach. In this position, we're looking at extending the hip. Again, contracting that glute or bum muscle to get the strength. So in line, arms can be by your sides or up. You're going to flex or bend your operated knee. Focus on tightening the glute muscles, keeping the back flat. You don't want to rotate. And you're lifting your foot up to the sky and down. Up and down. You might find that as you're doing it, the leg wants to flop inwards. This is a common experience for some patients. So you'll first work on controlling that the foot stays nice and straight up and doesn't twist to the side. Someone at home can just help guide initially to make sure the foot is extending up to the sky. So those are the 3 strengthening exercises. Again, if you can't do 5 in one go, start with 1 or 2 repetitions. Slowly build up your numbers. Quality far outweighs quantity. Alright, phase 4 exercises. They're all about postural strength, alignment, and also making sure the muscles are strong in the standing or walking position. So we've got one more big exercise for you to do, and the other 2 will be done in standing. If you are afraid at all, or have bad knees, this is one exercise you could maybe do less of or leave out, but give it a go first and see how you are. Please do not fall off your bed. So again, ideally do this exercise on your floor or in the middle of your bed, safety first. So getting on the bed, normally easier to get up from the bottom end of the bed. You're going to come forwards and you're going to be hands and knees. You don't want the arms too far in front of you. So shoulders underneath you, hips flexed to 90 degrees. And what you can start off with first of all is just extending the hip or stretching out your operated leg, holding for 5, 4, 3, 2, 1, and then down. And then switching sides. So we take weight on our operated leg and we extend the good leg. 5, 4, 3, 2, 1. And down. When you're doing this, try to make sure that you're pulling your belly button up towards your spine to keep your core or abdomen nice and strong, back nice and straight. If you find that that's easy enough, we'll add on the next part to this exercise, which is stretching out the operated leg and then extending the opposite left arm. So right leg, left arm, hold 5, 4, 3, 2, 1. And down, and then again repeating, taking weight on the operated leg, extending the good leg. 5, 4, 3, 2, 1, and down. So this will help strengthen the stabilizers. You want to do 2 or 3 on each side, holding for a count of 5 or 10 and just working through it. We then move on to our standing exercises. This ideally should be done with a mirror in front of you so that you can see where your alignment is and your pelvis. I'm going to show you just from the back so you can try and get a bit of positional sequencing. First exercise is going to be standing nice and tall, holding onto something, and you want to lift your good leg, taking weight on the operated leg. When you do this, 3 key features need to happen. You need to make sure that your head is over your shoulders. We do not want you leaning. We want a nice gap between the legs, so we don't want the legs together. But the most important thing is the pelvis. You want to make sure that you are nicely lifted on the good leg. So we want the gap, lifted left hip. We do not want this. That means that our glute muscle is not engaging and not activating properly. So nice and tall, gap between the legs. From here, you want to see if you can take the good or the operated hand off first, so that the good side is holding. 5, 4, 3, 2, 1. And eventually getting enough strength and stamina to be able to take the good hand off, or left, opposite side, and be able to stay still, straight, and keep the gap. What you'll find is that you want to do this, and you're working on controlling that you can keep yourself nice and tall, balanced with correct posture. This exercise you do want to do throughout the day. So if you can do it when you're brushing your teeth by your basin, every time you put the kettle on for a cup of tea or coffee, do it, so that we're looking at doing it 5 or 6 times during the day. Alright, our final exercise requires you to have a telephone book or anything at a low step that's going to give us a little bit of height, and we're going to work on our hip hitching with this exercise. So what you do is you're going to stand on the book with both feet. Your operated leg may bend a little. Your left, in this case my left good leg, remains straight. So I'm locking my leg, I'm not bending my knee. I take my left leg off the book, putting it down next to the side of the book. Now again, keeping my knee dead straight on my left leg, I'm going to hitch my hip and bring my good leg back onto the book. So that means tilting the pelvis up and down, up and down. Holding on it first, give yourself as much support as you need. Eventually you'll be able to go with one hand or the other hand. If you don't have a step around, no access to a step or telephone books, you could also just do this standing, again holding on to something for support. You can practice doing the operated leg first. All you do is literally just lift your right foot off the ground, keeping everything straight, nice and tall, posturally correct. Hold, 3, 2, 1, put it down, and then see if you can do the same, standing on the operated leg, lifting through the left hip, hitching it up, knees are locked and straight, left foot's off the ground, 3, 2, 1, and down. So once again, reiterating, you want to make sure that you are using and activating the correct muscles when you're doing these exercises. If you can't get the exercise perfect without holding on, make sure you hold on it first. Take 2 steps back, do 1 or 2 repetitions well, rather than trying to do 10 incorrectly. Everything's about reminding and activating the right muscles to get your walk looking perfect. If you have any questions, obviously don't hesitate to contact any one of us, the physios, to help you along the journey.